Share this.
Now, what I am seeing on my end is a very extreme close-up of you.
Good.
And then I'm also seeing this plastic box that needs to be moved. Bravo.
Thank you. I'm gonna hit this.
Slide deck coming. I could see it's on its way.
We got it live.
We have a slide deck and we are streaming on YouTube. And let me start recording.
Sweet. Thanks, Greg. You the best.
Yep.
Her door is just off.
I want to go there. Good. Yeah.
Or,
Yeah.
under.
Reservation that you do.
Yeah, she's a big one, yeah, you know.
You do now. I was debating going there for a call.
I might ask somebody from Amanda's.
Timing was tricky. March sure it'd be really hard
Aria.
for a 1-year-old.
If you don't mind self-collecting.
Instead,
Just because they only.
I'm gonna mute us for now.
not. I would imagine, yeah.
I can advance the time as you need.
Hi.
Hi, Rachel. Hello. I'm sorry I haven't met so many of you. Well, now hopefully we've met. I'm Rachel. I'm with the city for 2 years as a City Hall fellow through Harvard Bloomberg. That's enough. And I'm serving as a community climate action coordinator. So I'm taking on a lot of this work once this committee has ended. So if we haven't met, that's who I am. I only came in the end of August, so I really haven't had much opportunity to be here. But I'm really excited to lead this. Most of the other staff members who are working on this committee who you've met, like Bree, Lindsay, are on vacation. So this is a great opportunity for me to practice. But also we have three amazing speakers, or discussants maybe, because they're going to be leading discussions at your tables, but who are going to do the bulk of the work today with me. So I just wanted to shout them out. We have Amanda, we have Aria, who might be joined by Benny, and we have Deanna. But we'll go into who they are in a second. But yeah, so if we could just look at the agenda. So then we'll be doing our activity and then we'll close. I just want to do some quick housekeeping. If you go to the next slide. Perfect. I think everyone here who's on the committee has done a W-9. Great. Okay, so it's people who aren't here who haven't done the W-9. Perfect. We can keep going. I also wanted, before we get into the activity, shout out with the inspiration that's come from this committee. I think I mentioned it briefly at the end of last meeting. We started with our first pilot talent incentive program. So from the feedback that we heard from you from the first like 8 committee meetings or so, we heard that we wanted like something challenging, something that was like people could kind of compete playfully against each other, but also provide incentives to like do climate action and make changes. And you can definitely do the QR code, but I'm gonna hand out or pass out the bingo cards, the physical ones. But there is, if you scan that, there is a digital one. There's a PDF. You could print it, you could share it digitally to your friends. So I'm just gonna ask you as members of this committee, if you could share this in your networks or encourage family, friends to do it, or coworkers, or however you deem interesting. If there's a way you want to integrate it into something else you do, that would be really awesome. And also if you have feedback on it, like if you want to come to the next meeting or if you want to email me, you can email climateaction@cityofboise.org with any feedback. This is the whole point of this, is to see if it works. But, and to see if this is kind of what you meant by challenges and things. So the goal of this is to, of course, the goal of this is to help people think of new ways to decrease their waste and consumption through the holidays. If they complete a bingo or if they get a blackout, then they will be entered to win a prize. But it's also kind of fun and it gives you new ideas of things that you might not be doing in terms of waste and consumption. Yes, I just wanted to do that before we got into our activity of the day. Does anyone have any thoughts or comments before we move on?
I haven't read the site yet, but the submission, is this more just for the city to get a sense for what folks are doing, or is there anything else people should expect when they submit?
Yeah, if they submit, they can be eligible for a prize.
Okay.
Yep, that's how we would record they've completed it. If you're interested in like leading an event or something that wouldn't involve submission, like we were working with some of the green teams at the schools and they're like, can I just give you a pack of them? And I'm like, yes. If there's something like specific like that you want to do, that we can talk about that. But if an individual were just completing it, the way I would know is they finished the form.
Okay.
Yep. We didn't want to make people have to like come to City Hall and like.
Oh, no, it makes sense.
Get them. Yeah, I guess if they wanted to. Other questions, thoughts, reactions?
My other question is,
Yes.
when today I missed on the agenda, are you gonna update at all on kind of like the current status of things? Like, you know, I know last time we were giving feedback on some of the decision tree, kind of good, better, best stuff. If that's at some point.
Yeah, I can just briefly mention that we finished the copy. So all of the text on that, based on your feedback, we made it a lot more actionable. We made sure there was a level match with each of the actions, but now we're really just working on like doing the logic, which takes a lot of, there's like, so I haven't, like the update is that we're working on the logic, which isn't such an interesting update, but it takes a while.
For a January launch, so.
For end of January launch. Yep. So you'll all be invited to that. Cool. I want to make sure we have enough time for all of our beautiful discussions today. So I think we'll move right along. So I'm going to introduce, we're going to be doing an activity with each of your groups, talking about climate action through different lenses. So each of the people at your table are an expert or experienced in some specific kind of climate action. And we're going to talk about that, and maybe we will see how it applies to you, your communities, your life, and see if there's new applications we can have in terms of like niches that we can use in this program. So if we go to the next slide, I'm going to introduce each person one by one. If you can just talk for like 3-5 minutes, however long you need to introduce yourself, your role, and the unique lens or population that you're dealing with in terms of climate action.
I'm Amanda. I am an emergency medicine PA at St. Luke's. And I also work with Idaho Clinicians for Climate and Health. And we're a group of volunteers, community-based. And our main goal is to increase kind of discussion awareness and implement solutions around how climate change and the environment impacts health. And then, yeah, the solutions are both community-based and in healthcare settings that we're improving sustainability. I like to think that it's not that niche. I mean, there's definitely vulnerable populations that are more affected than others, but I think everyone is affected by our environment and our air quality and our water quality and our soil. And I like to make the analogy of if you look at a fish tank that's really gross and moldy and dirty, it's really obvious that those fish are probably not super healthy, but sometimes it's hard for us to see our own environment and the macro scale when we're living in it. We probably feel it during like wildfire season is an obvious one, but all of the things that we're doing to our environment directly impact us as a community and as patients. Yes.
Thanks.
Can I say something?
Yes.
Just very quickly, I attended several. of
Yeah,
those
we did that before.
meetings, and they're so good.
Oh, thanks.
They're so good. Oh, they're so informative and it's really always helpful.
Are you in medicine? What?
I'm not in medicine now.
Okay,
I just,
you're
I'm, you know,
I wonder-
but I found out about how to listen to your programs.
Yeah.
Through a climate organization that I volunteer with. So I've attended just, as this person in the community.
Yeah, we have a monthly lecture series that's like sort of health focused, but anyone can attend. And we focus on something different each month, like mental health or birth outcomes or respiratory problems, etc. So that's through St. Luke's. That's a joint mission with St. Luke's and ICCH, but we also work with PA and Full Circle Health, St. Helens, etc.
Do you focus at all on some of the waste produced by hospitals?
So
Great.
the health, yeah, I was like, I feel like when I start getting like in the next layer, I could talk forever.
Yeah.
So I was trying to keep it brief, but yeah, hospitals and healthcare produces like 8% of carbon emissions in the United States. We would be, the United States health system would be like one of the top world producers as a country. If you look out a few scopes, especially at like pharmaceuticals and like buildings, etc. And so it's also trying to take some responsibility without compromising how health workers and patients experience, which there's a lot of low-hanging fruit for, like certain things that are on all the time in hospitals that don't need to be, or certain like high producing volatile noxious gases that you can easily swap out for a different gas that's much less ozone degrading. There's just a lot of layers of things that other there are good examples of hospital systems that are net zero even or doing great jobs, but it's trying to get us to that level in Idaho for Idaho. Yeah.
Aria.
I'm Aria. I'm a senior at Boise High and I'm a co-chair for the Youth Climate Action Council. So the Youth Climate Action Council is a group of students who come together every year from across Boise. And we discuss how we can, one, get youth involved in climate action and kind of try to involve the community itself. So last year when I was on the council, one of the main things we did at our project was we hosted a booth at Tree Fort about textile waste, about education about that. And then we also, behind our booth, had a thrift store, a free thrift store where people could swap their clothing or take whatever they want to kind of promote that the slow fashion or like reusing instead of fast fashion, especially for festivals. We also do a climate action summit every year. So this is when students interested in climate action, whether they've been doing it for years or just are getting into it, we all come together for a day. We get to listen to a speaker speak about some sort of climate thing that they're related to, and then we break out into groups for other climate related topics that more involve Idaho. So last year, our breakout groups were surrounding ranching, recreation, and agriculture, which are all pretty Idaho centered. But yeah, my goal or my job as a co-chair is to kind of promote climate action towards the youth and not only like inspire the people on the climate council, but just spread the message. I also help find the speaker for the climate summit, and this year I think the speaker is going to be talking about the decarbonization of schools, which is really cool. So I'm really excited about that. But yes.
Deanna.
Hi everyone, I'm Deanna Dupuy. I came to a couple of the committee meetings at the very beginning of this, and then life and things, I started working on other projects, but I'm happy to be back here. I am the planning manager, so I focus mostly on comprehensive planning, long range planning for the city of Boise. And I would say I'm not an expert in my topics that were assigned to me, but I'm acutely aware of how challenging they are. I think I'll be talking quite a bit about like how do you engage different populations of folks, and especially when they have a lot of competing priorities, whether it's just, you know, living life or affordability particularly. That's something that we've found a lot through our planning engagement work of just how do you have a conversation with folks about the future of the city when they're focused on so many other urgent things right in front of them, and how do you not make one voice kind of skew a conversation that might not be representative of everyone. So I've done quite a bit of engagement through City of Boise projects that we've worked on. I've been with the City of Boise for 7 years. And before becoming a planner, I was actually an elementary school teacher at a pretty a Title I school in Dallas, Texas. So really thinking about who benefits from decisions that we make or opportunities that we create.
And so we have about, what's gonna happen is, eventually, in a second, we will split into our 3 groups and have deeper conversations. Each of the discussion leaders have questions that they might use, and your goal is to kind of think about how this might apply to climate action, particularly in communities, or as it might apply to the larger work that we're doing. And then you'll be recording that on either the whiteboard. That was way too high for me to write on, so I gave you an extra piece of paper. Or yeah, so that way we could share out. That's perfect. Hello. So yeah, so we'll go into that for a second, but because, and then each group will share out. So we'll have about at around like 5-10-ish, we'll be a little before that. Each group will share what they kind of discussed using their whiteboards. But since you're not going to get to hear from each of the discussants if you're not at that table, I know there was one question before. If there's other burning questions you have, let's spend about 5-10 minutes or so. Feel free to raise some questions for other people, especially if they're not at your table. So if anyone has questions for Deanna, Amanda, Aria, from any table, now's your time.
I got a question more about hospital waste again, or net neutral. Are you seeing in any of the European countries just a different approach to how they manage what they use in terms of whether it's I won't say syringes, but the hospital equipment that you go in and it's plastic and they use once and toss away, or the management of the electricity or turning things on and off, or different approach that still meets the healthcare needs, but also meets climate needs too.
Yeah, is there a reason you're asking about Europe specifically, or?
Just in general, often it seems more progressive than other places, but it could be other countries too,
Yeah.
or other hospitals in the States.
So the reason I say that is because there's a lot of other countries that out of necessity don't use single use because of the cost. And there's been studies done that it actually does not increase the rates of infection, et cetera. Like I did medical rotations in Bolivia where absolutely everything was reused, your gowns, your shoe covers, your instruments. Like the level of waste here it like hurts a little bit when I tell you that the instruments we use to suture in the ER, those like sterile steel materials, we throw those away. I literally ask my patients if they sew or fish. Say, here you go, here's some alcohol swabs, take them home with you. But like our level of waste has gotten pretty crazy because of this idea that it's more sterile. But there's studies, and so yes, there are European countries that are doing it out of like more responsibility to the environment. There are other countries that are doing it out of necessity for the cost. And so with single-use plastic, certainly there's also just more responsibility in some places. The cost to process one of those hazardous waste material bins versus general waste versus recycling is like just really, really high. And so if you're putting the wrong materials in the wrong bins, the result of that is like a big problem. And providers and health workers are not necessarily educated that like just the needle goes in this, not the whole syringe on the back of the needle. And so yeah, there are countries definitely working with it differently, but that also, like, we think a lot about single use, but there's food in hospitals too, and there's just other general equipment and yeah, there's entire like composting systems in hospitals that then can use the gas and the like off gas to as energy as well, create like a full loop. So yeah, there's a lot of examples of single use and waste management being a lot better, and including in the US. We can talk after too, like Gunderson Health and Providence Health are,
That's what I was gonna ask.
yeah, amazing jobs of, there's quite a few examples of leaders in the US.
Thank you.
Where does St. Luke's fall? Is it, like, I mean, is it like where everyone else is, not, or is there like any progress being made at St. Luke's level?
Yeah, I am not representing St. Luke's, but
Sure.
I'm an employee there,
Fair enough.
and I
Or
have worked,
Idaho Healthcare.
I have worked closely with the leadership and sustainability at St. Luke's, and like just getting us to like get the metrics has been challenging. So I actually can't even tell you where we stand. I know what, like, there's certain projects we've implemented that I know have improved it, but like as a where do we stand, I couldn't tell you because we don't have the data.
Sure.
Do you find that when you talk to people about how climate is entangled with their health, do you find that they're oblivious to the fact that those two are connected, or maybe just like ignorant or something? Or
Yeah, I wouldn't even say like they're ignorant. I've talked to a lot of really intelligent people who even work in sustainability who are like, gosh, I've never thought of that. And so that's kind of why our group is doing some of the work we're doing. And some of it's more hands-on and solution-based, but a lot of it is just about educating the public, patients and health workers. Like, this is a link. To me, it seems silly and almost obvious at this point, but a lot of people have never thought about it before. So yeah, that's a big part of what we're trying to do. And it's not their fault. It hasn't, I feel like I relate it to like mental health. Like, people weren't aware of mental health in the 80s and 90s. And now like every single large corporation is thinking about it when they're hiring employees and incorporating it. And so it'd be really nice if the same thing happens for climate and health over the next decade or two, that is they go hand in hand. Because I don't, whatever, things can be argued everywhere. I don't think there's a good argument against helping people's health. Yeah, and the cost of, yeah. It's just like a net. There's synchronicities that you're helping the environment, often cost savings can help people.
Do you find that people are more receptive to that, like the intersectionality of human health and the environmental health piece? Like within the health system, it's like everybody's obviously conscious of like.
I don't know, that's everyone. I wouldn't say everyone in Idaho necessarily.
Yeah, that's fair.
Yeah, but no, I think there's even, like, it's not something that you're trained in when you're going to school, as a nurse or respiratory therapist or doctor, but like, there's definitely, yeah, no, I think there's a gap. To answer you plainly, there's a gap even amongst us health workers and at scale for running the hospital and the employees.
And this is kind of a follow-up for all three of our guest speakers today, but what are you seeing the enthusiasm to be like in your various realms, or like the willingness to actually do something change?
I feel like against people's perceived thoughts, and we're actually really excited to fight climate change and participate in climate action. Even just my whole group of friends, I told them, come to a green tea meeting. And I think not having a so sour perspective about climate action, not saying like, oh, this won't ever work, or, oh, this is gonna fail, instead saying, maybe this small change can help us do this, because just those small wins, I think, this build of confidence, especially for youth. One of the projects that we're doing with time revolves around idling, because our school doesn't have a parking lot, so everybody parks in the street, which leads to a lot of idling in the morning, because they have to get there 20 minutes before school starts. So I was talking to one of my friends about this, and he was like, "Oh, idling, you'll never be able to change it. Why do it?" And I was just saying, even at Boise High, if we can reduce it a little bit, maybe that might inspire someone else. Or at Boise High, if we can reduce it, maybe we might catch the attention of another school and stuff like that. So I think highlighting the small wins really gives the enthusiasm and builds confidence.
Can start with the parents, because I yell at my son every morning when he calls. Hi, Mom, turn off your car.
Other,
Yes. I think this is a hard one if I'm speaking more about like how you're getting all folks to engage. Because I think there is a level. The world right now is very chaotic, and I think a lot of people are either very in their own space or kind of like deciding to kind of put their head down. And I think just like finding common, like whether it's common values or even like what's in it for them. Like I think a lot of people are feeling like the kind of like, well, how is this going to make my life better? Has been like does lead to some enthusiasm, but I don't think I have like a very inspirational thing about how to engage all folks right now.
I have like a succinct three-part answer to that, but that is like at a hospital level, if it's cost savings, they're excited. Which there are a lot. At a like health worker level, I think there is still a lot of burnout that people are experiencing. And so for a small portion of folks, it's like excitement that there's this intersection of where they can make a difference and be a provider. But then for a large population, it's like, I can't take on another thing right now when it's already like a stressful, overworked job. And then I think at a community level, there's a lot of excitement around the conversation around health, climate.
There's a lot of work.
Excitement
Excitement.
at the community level for the intersection of climate and health. Yeah.
Thank you. One more, otherwise we'll go into our groups. No? Perfect, okay. I think we should go right up until 5, and then we'll do, each group will share for 5 minutes at around 5. Great.
Just slide his tail.
Yes.
Mute.
Take notes.
Take it back. Take it back. Take it back.
Serious, wait for the next.
Yeah.
I feel it.
Teeth drops. It's like the.
All right, so we're gonna do 5 minutes about for each group. I'll time you if you're, keep going, then we just keep this moving. And group 1 will go first, 2, and then 3. Sound good? Whenever you're ready, group 1. Report out, yes. Report out.
You want me to summarize, yeah? Or do you want our members to?
It can be you, it can be whoever in your group wants to chat.
Great, so we didn't quite get to our final
That's
question
okay.
about our
Just a guide.
cities
All
rule,
good.
but we had some really good discussion around health in Boise and the greater area. One of our first discussions was just about like who's most vulnerable and why that mattered. So we had they nailed it. So our vulnerable populations include elderly, young, folks with chronic disease. But then also, something that we think about in Idaho is heat and air quality, especially in the summer. And that really heavily disproportionately affects outdoor workers and agricultural workers. And there was a insightful comment about like, we might not have it as bad as maybe Arizona or California, but the kind of retort to that is actually a lot of these states have worker protections that we don't necessarily have in Idaho. So our agricultural workers specifically, but other types of workers are actually really vulnerable because they don't have mandatory breaks or shade or water. And we got into a little deeper discussion, which seemed interesting to you all, so I'll just share with the rest of the group just about how with heat and with air quality, as we're seeing temperatures increase year over year, we're calling chronic kidney disease the disease of climate change in the way that lung cancer was to smoking. So there's certain populations in the past that have had higher risks of kidney disease. Now we're seeing it in healthy, young 30-year-old men who have been working outside all day, just because the body isn't really able to process that much heat and that much work and that much buildup of toxins. And so that kind of led to that interesting thing that like there's definitely folks that are more vulnerable that need to be protected, but there's also just healthy people who are experiencing the effects of this. So it's not necessarily the other, which kind of got to an important part of question 2, blending that's like, what are people's motivators? Sometimes it feels like if it's, someone you don't know, or if it's really far away, or if it doesn't affect you directly, you're maybe not as motivated to change. But I think everyone probably knows someone with some sort of health condition, maybe someone who's old, a kid, but also even if you're eating well, sleeping well, exercising right, doing all the right things, this can still affect you as a healthy individual if your environment isn't healthy, which is not to depress you, but just to get us all on board and realizing that like this really is something that touches everyone across, like money can't save you from the air you're breathing outside. There's definitely people who are more affected who don't have quite as good air filtration on their house or who are unhoused, but we're all being affected. So yeah, did you want this just like we're summarizing, or we're just giving our, I don't know if the group has other motivators.
No, everyone can chat.
Yeah.
What else?
Or I don't know
else?
if they did.
Oh, you guys.
Yeah.
Yeah, we have 1 minute. So, and then I think we'll do like after each one, like one or 2 minutes of questions. So
Cool. 1 more minute. All right. So some motivators was that like everyone's affected. There can be like significant cost savings when we're improving our environment and people's health because you're paying for less healthcare if there's less sick people. Something that seems to like hit people was, fertility is affected. That seems to be a big motivator for folks because we know a lot of plastics and chemicals are endocrine disruptors or hormone disruptors. Decreasing how much medication you're taking is definitely a positive for a lot of folks. And I can say there's data to back everything I'm talking about. And then lastly, we were discussing like, is this a conversation to have with your health provider? Is this something that could happen in the office setting? What are the pros and cons of it happening there? Some of the pros are like, some people really trust their healthcare provider. They feel a lot of credibility from them and would take that information to heart. Others feel like some folks aren't really willing to hear that in that setting, if that's not what they're there for. And I'll say as a health provider, sometimes it's tough to also squeeze that conversation, even though I care about this a lot. It's sometimes tough to educate on that in addition to everything else you're trying to educate on in 10 to 15 minutes. So
Absolutely.
Yeah.
Do people have questions for this group? No.
great, thank you.
Thank you. Thank you. Thank you so much for coming.
Yeah, of course.
Does group 2 want to go next?
So we kind of talked about mostly about how we get youth involved and some barriers that come to climate action, and then how do we keep the climate action going. So a lot of it focused on community building. One of the sayings that kept coming up was small hinges swing big doors. So small actions and like sorry, I'm losing it. Small actions can lead to something big. And I think especially for you and also everybody having this like achievement that they can see, this like tangible achievement that they can see is so important that it opens so many pathways for them. Another thing we said was to get kids involved in climate action is to put them in nature. As we grow into a more digital world, I think, and become more urbanized, kids are losing the ability to connect with nature, so they don't feel as much of a push to protect it. So that was one of our big things to, yeah. And also I think in putting the words in like it's cool to care about climate is super important, because I think, like I said, youth are already motivated by this problem, but just giving them that extra push is something that can work wonders. Also another thing that we talked about is how important community building is and connections. It's just, I think, especially with kids, having a community that you can talk to, that you can rely on, that you can relate with, is gonna foster a much stronger sense of hope in you all. And I've seen this happen with a project that I was leading over the summer. Even just some people that I've never talked to before, we all came together to, it was a project about the monarchs and the declining monarch population of the sea. But by the end of it, we were all really close, and they all had a heightened sense of care about the monarchs and to take wherever they want. And another resource that we talked about for how do we get kids in climate action is trust. I think saying, especially for parents or people who are older, instead of saying like, oh, we know more than you, we're more experienced, saying stuff like, wow, okay, tell me more about this, or yes, we trust you, how can we help? Something like that. Those words of encouragement and trust are so impactful, especially for kids who may think like, oh, I'm at a lower position in life. So, oh, I don't know as much, I'm only a high schooler. I think those are big barriers for kids to take climate action, but providing this support for them is one of the biggest resources, besides obviously education. We talked about the lack of climate education, even when there's supposed to, I think in the Boise school districts, at least, there's a climate change unit or some sort of education. But yeah, support is one of the really big resources that could be provided to youth by really anybody in their community. Just I guess empowering them to not only continue to take action, but just talk about it. Even talking about it is so like, it's like very helpful.
And there's tons of role models out there for them in
Yeah.
their age group, but.
Questions?
I was just say, I love that, and I think like even the little phrases we use is so helpful for like a practitioner, just like to remember that, like, or like using the, like, yeah, small hinges, big doors, like that's really helpful for practitioners to take that in when they start talking to you.
Else? No? Okay, group 3.
So our team, this is as much as I wrote, but we wrote a lot on this paper and we had a great conversation. And we focused on talking about kind of climate and affordability, and then also what does that mean kind of around engagement, like these terms like engage the unengaged, or and then what's the city's role in that. And so we had some really great conversation around affordability and thinking through, you know, the easiest thing to is like, let's subsidize actions for low income folks so that climate action is more affordable, because cost is a big barrier. You know, whether it was subsidies for energy efficiency or making sure there's recycling in these areas, but then started to have a conversation around that doesn't, we also need that engagement and education around that. So you can provide that subsidy, but also making sure that we're having that connection there. And then kind of a big idea coming out of there was thinking about the success of the just recent clean water air levy that just passed, and thinking like whether or not even a bond or a levy around this would pass, but the amount of engagement and education that goes into kind of a ground game of running a campaign like that, I think is a really interesting idea around connecting with people and finding out like what matters to them and how to like identify those needs and values. So there was a lot of conversation there that really it's connected. And then moving more into that messaging, what type of communication works best. I think it's sometimes like, well, if people don't care, they don't care, but they do care about something. So you need to figure out what they care about and try to connect that to climate action, because we, I mean, as group 1 talked about, I mean, it impacts everyone at all pieces. So we can find out what gets them there. And then this idea around communication, find leaders already in the group, and people are already doing this community organizing work. You don't have to reinvent the wheel and just find them. And then the other idea of just like bring one more person in, like everyone knows somebody that they can connect to, and that helps build strength in that network. And then we had some questions around like, what's the role of the city in all of this? And I think providing that information, whether it's about who lives in our city, data as much as we can about what is happening in this space, and then to facilitate and create collaboration so that people who are doing this work could continue doing, and the city is just facilitating, similar to like what we're doing today. And if anyone wants to add it.
Yeah.
No, that
Or
was
question.
great.
Nicely done.
Yeah.
Question? Affordability? Okay. I'll just, maybe we can have a round of applause for our guests. Thank you to Amanda, Deanna, and Aria for being here and sharing your unique perspective, lens, practitioner work, but also just your personal selves with us. So we really appreciate that. I mean, I won't speak for too long on this, but there were clearly some like overlaps about like listening to people and what they care about, and then speaking to how climate change interacts with that, and then also trying to figure out what they need to get there. Whether it's like a personal, like it's going to affect them like physically or personally, or it's like well, if we, you know, we start small, maybe we'll build up. There's a lot of different pieces and threads here. So this was really fruitful for us to take some of this data in terms of like how we're thinking in terms of different populations or different lenses, or how other people might come to this kind of work. But hopefully it was also fruitful for you. We just wanted you know, it's a vacation tomorrow and so people couldn't make it. So we wanted something that was a little bit more discussion oriented and so thank you. This was great. I hope you thought that too. And don't erase anything because I'll take a picture once everyone leaves. So we have that. I would love to take a picture of that. That's extensive. It's the slide. Or is that it? Oh, okay. So our committee meeting for December is to be determined. As you know, that is our final committee meeting. So thanks for being here in the long haul. We hope to make that some kind of like celebratory, reflective, group time. Like we probably won't, we'll give you an update, but we probably won't generate too much, but we'd love to have you there so we could really celebrate your amazing work all together, but we'll let you know the date and the time. It might need some moving around based from what it originally was, just so we can make sure we can honor you in the best way possible. Well, and as you know, we've already started piloting the Keep Boise Cool program that you've all formed, so thank you. The official launch is the end of January, but we're piloting some different kinds of the bingo cards, but also the kinds of events we might have or the way we're seeing how they're gonna land, who's coming, why are they coming, are they engaging, who comes to more to what. So we have two that might happen. Hopefully I'll see you before December 17th, but I put it here just in case because the Eventbrite is already live. But we have the Science on Tap on November 17th at Old Speak. Feel free to join us. We're gonna have Jen Ellis from BSU. She works on waste reduction stuff, so everything's focused around waste. And that's 21 plus, sorry. But you know, we'd love to have you there and have a beer and learn about waste reduction. Tell your friends. Yes.
Can I say something? There's a Science on Tap actually today at
Oh, yes, there is.
5:30 that's about single family zoning and ecology. So could be
Yes.
interesting.
I think it's right now.
Yeah, I know. It's at 5:30 at Boise Brewing.
I would have included that, but I didn't know if that was, I don't want people to drive poorly to get there. Well, you can.
Yeah, you done as poorly as you want.
Yeah, we're piggybacking onto an existing program through that some BSU professors started. I think we might have talked about this last time, but I'll just mention it, that they do like, they figured how great it is to like have a pint of beer while we discuss our science research. And so we're collaborating with them and expanding it. So once a quarter, we'll have one that there's the speakers more focused specifically on climate, although, you know, sometimes that just happens that way.
Are these communicated out by like a city newsletter?
It is in the newsletter, or it should have been in the newsletter. Yeah, and it's also on the Science on Tap website. Should also be on the Watershed website if you get those emails. So it's in all of those places. Yeah. And then we're gonna have a documentary screening about cargo bites called Motherload. That's gonna be at the Watershed. That's December 17th. I will be there. That should be fun. And then, yes, I have more bingo cards. So if you have places that you feel like whether it's your workplace or your other friends or family you're gonna see who might want this, feel free to put it out wherever you want. Or take one extras. I think that's it. Does anyone have anything they want to add, need to add, questions about? I know there was a question about where we're at in the launch. I hope this also clarifies things. We're planning events for the next quarters, but we're also refining the website tool. Happy to speak to anything else.
You typically RSVP for these events?
Yep, Science on Tap. There's an Eventbrite link. Although I think if you're 21 plus and you just showed up, they'd let you in. But we'd like to know how many people we have in mind. And then Motherload, yes, there's an Eventbrite link for that. I think that might have a capacity.
What's the source of that document?
The source of it?
Like who did it?
I actually don't, I didn't pick it. I don't know the answer to that. If you look up Motherload, I'm sure. I think it's about the intersection of like motherhood and climate change, and then how cargo bites might be a solution to that is, I think, the premise of the.
Yeah. I see.
Is that also at 5:30 then, or?
I didn't put the time on that one. I think that one might be, I think it is 5:30 to 7:30 or it's 6 to 7 or something like that. It's a Thursday night. I think it's a Wednesday or Thursday night. You tell me you have.
It is
Calendar.
Wednesday night.
Wednesday night, okay. I think it's 5:30. Yes, I don't have the link to that one there, but if you search Motherlode
Yeah,
Watershed, I'm sure it will come up. Or just watershed. Great. Well, I'm around for questions. I know we're a little early, so thank you so much again for discussing. Thank you for coming, for being here. See you next month.
Thank you, online folks, for signing off.
But you guys are so smart.
I was thinking that sounds cool. We just got.
Yeah.